Here we
Cool.
go.
Here we go. Yeah, excited for the Around the Oasis discussion with Liana here today from Embry Tech. And yeah, really enjoyed our meeting a few weeks ago, one of the first in-person meetings we had, you know, as Boston started to open back up here. And yeah, just excited for this chat. You know, we keep these pretty conversational, getting to know the community members and the Prepare for VC Oasis, and really like telling their stories, and learning from each other in these Ask Me Anything formats. Yeah, so Liana, it's great to have you here, and would love to have you give a quick introduction on what you're working on, and how Embry Tech came to be.
Yeah, sure. Hi, guys. It's so nice to be here, to be part of this community. Happy to jump in and just talk a little bit about Embry Tech and how we got around. So basically, I am a co-founder. There's three of us, three co-founders, and the whole idea came out about is to actually, can we build a hidden scale for weight management, for helping people to stick to their weight goal and get to the goal. So that was the original idea, and so we started developing, three of us. I have more of a wellness nutrition background as well as business development, and that's the hat that I carry on within the company, helping with all the health content within the application and the product, as well as business development within that industry. My other two co-founders, Sarkis, he's the CEO and has the, kind of the entrepreneurial and IT background. And Nada, she has the product design, UX, UI design background. So, these are the hats that we wear. Today, Embry Tech is basically, it's a system of hardware device, which is a smart insole and an application. And that system helps you to keep you accountable on your weight management journey. And with kind of that system, the device itself tracks your weight fluctuations on the go, which is the kind of the premier and the most distinctive feature of a product, and it's patent pending. And then we also track physical activity, sitting, standing, very passive time, active time, steps, and we take that data, we analyze it, and then we try to predict your behavior and help you to take control of your basically health on your weight management journey. So that's the value that we give with Embry Tech. We're pretty excited. We finally have the product out. And if you guys are curious, it's actually right in front of me here. Happy to show you how it looks. So these are the insoles right here that you put in inside of your shoe. Connected, you connect through Bluetooth to your application, and you receive your data recommendations based on your goals. So yeah, so that's kind
That's
of in a
exciting.
nutshell.
Yeah, so you'll just have different, different sizes, and you put it right in your shoe, and it tracks everything right there for you. Connects to your phone.
Yeah. So basically, if you can see on the back here, you can cut a little bit to your size if it's a little bit off right here. And yeah, and so basically you connect through Bluetooth, you pair your device basically to your application, and then you wear it basically throughout the day. You put it in your sneaker, in your kind of casual shoes, and you get your data on your phone regularly, and you get to track your weight. Hold on, let me see if you guys want to see it. I can show you because that's pretty cool. That's the unique kind of aspect of our application. Hold on. So here you go. This is the weight graph that you guys can see as the weeks go by. The green line is basically where my goal is for weight, and the dots is basically where my weight is in accordance to my goal. So yeah, it's pretty cool. And you kind of get to store your data and see, how your behavior basically affects your weight, your physical activity, and how physical activity affects your weight.
And how did you all come together to start this? Like, how did you even meet your your other two co-founders
Yeah.
there?
Interesting and very important aspect, actually. So actually, Sarkis and Nada came up with the idea as a product owner, product manager. She really, she was the kind of the power behind this idea. Partially, having people around herself that were struggling with maybe weight, and she felt that that would be a great component. And then Sarkis was her friend at that point, and he had the engineering background, and she's just like, hey, can we do this? Is this possible actually to do? And that's how they started developing the idea of building hidden scale. And during their first pitch ever, that's when I at that point was also, kind of trying to understand what I want to do with my life. How do I want to bring wellness? How do I want to scale wellness? Applying technology, applying my business skills. And so I was kind of looking around and, serendipity, here I was in the audience listening to various startups pitch. And that's when Sarkis was pitching the idea. And so I came up to them later and I was like, hey guys, it's a cool product. I think these are some of the important things in the market that you guys should know. And so I started just kind of telling my perspective of the product and where it should go and how it should go. And so, we exchanged phone numbers. And then after that, for 4 months, we've been kind of talking. I was consulting on the market and the industry, having the nutrition background, alternative health background, being passionate about wellness in general. And so, we hit it off. I loved Sarkis and Nada from the first sight, loved their energy, loved their enthusiasm. And so, after 4 months, we decided to work together and actually work on this idea and develop it further. And it basically ended up being a preventative tool today and trying to serve and help people to take control of their weight management journey.
Oh, that's exciting. And
Yeah.
I really like that because most people just think of, pitch events as you're either getting your idea out to potential users and customers or to potential investors. And you found, a way to like join the team and, be a co-founder and be a part of this.
Yeah, absolutely. Again, it's a serendipity piece in my life personally. I think it's similarly on their side. But yeah, it was exciting. We were all eager, to build something new, something exciting, something will help people on their wellness journey. Absolutely.
It's really cool. Wonder if I could ask a question of my own. So,
Sure.
Liana, as you know, you and I met right here in Boston at the Boston New Technology. I think it was one of the showcases. So my question is,
Hmm.
like, when you first started getting, getting to know this community and everything, versus now, what have some of your takeaways been generally about the startup ecosystem in Boston?
Hmm. I think as time goes by, it becomes more and more cozy and warm, and if I can put it that way, where there are more tools and education and experiences available for especially new founders, newer entrepreneurs, first-time entrepreneurs. I think ecosystems are extremely important for the first-time entrepreneurs, just because you need the support system. And I think it's definitely getting out there. And I think COVID also actually expedited the whole experience because everybody went online and everything became even more accessible. If previously, you had to go out, be there in person, today all of this is online in your phone, just under your tip of your finger with a question. And I think your program also have been, a huge component in, helping co-founders go through this experience and make it less painful.
Thank you.
Oh, that's
Yeah.
great. And and I know you mentioned, now you have, or your co-founders are in different locations, or you were splitting where you're meeting with people. You were out here meeting with people in Boston, and one of your co-founders were out in California. And
Hmm.
I guess how do you think about the locations you guys go after, and where it makes sense
Hmm.
to
Hmm.
meet in person versus virtually, and who you're looking to connect with now.
Yeah, it's a great question. And we also in the beginning kind of were like, how are we going to work this out? Where should we be? Because our R&D team is actually out in Armenia developing the technology itself, and the business team is out in the US because that's where our market is. And with this fundraising that we're doing, we want to build larger marketing and sales team out in the, still thinking if it's most likely will be in California. And I would say with the technology being available, again, COVID expedited it so well, it's no longer a problem where you are, which part of the world you are, as long as you have internet, you're fine. So we feel like it became much easier actually to have conversations, even with investors over Zoom, over video chats. So definitely it's no longer a problem. And we actually like being in different parts of the world because we get kind of the best worlds, right? We all take something from each part of the world and we bring it into the team, bring the experience into the team, the expertise. So I think it actually works out pretty well, and we're really happy about this. And ourselves, we travel between Armenia, California, and so forth.
And yeah, and so on your, you have a really cool product. Yeah, you showed us what it looks like on the insole, and how it tracks on the phone, your weight fluctuations and everything. So like how has the product itself or the application changed at all since the original concept? And how did you figure out like when you guys were on the right track to building something that people were excited about?
Yeah. Of course, when you develop product, especially like I said, we're all first round founders. It was, we were so eager to start building something that we wanted. At that point, it was actually a silicone ring under your big toe. That's how the whole idea started, and it ended up being an insole. In between, we had thousands of prototypes that we've tried, both on the tech level, on physical, mechanical level, trying to understand how we fit in everything and what's the most convenient, comfortable, sellable, and cost effective way of actually entering the market. So all of those decisions were kind of part of where we are today. And so it first started with a silicone ring, then it was a little pad under your balls of your foot, and then it became a 1/3 of a quarter, 1/3 of a insole length, and then we decided to actually be embedded right away inside the shoe without an insole. And then actually, as those decisions were made, we went into the market, we asked questions, we understood if we should keep going with that idea or not, what were the problems, we would try, test, give out to test to people. Even though, it was rough prototypes and there was a lot of, negative feedback, of course, because it wasn't the final product. So those were some of the process that we went through. Today we have a full insole, and we decided it would be the easiest, the safest way to go and enter the market. It is still a kind of a transactional product for us. It's not the final end product, because our vision is to be in every possible shoe out there. And so with the insole, there's limitations to do that. But we decided to start with that because it was with the budget we had, with expertise and the team we have and the tech development at this point, it's enough to enter the market, give value with an insole. And we decided to do that and no longer wait and keep on perfecting and making this, the final product, because we also understand that's the wrong way to go. So this is where we stop at this moment, and we're entering market with an insole, smart insole. But yeah, it's an awesome question, because again, it took us a long time to really figure it out and where we want to be and what we want to present.
Oh, it's always exciting to hear the story of like how you got to what we're seeing today. And I mean,
it's not easy.
It takes a lot of development and steps to get there.
Absolutely. There was a lot on the tech team, on the design team, on a business team to really figure it out, who needs what, why, what's the cost, right? Because
Right.
at the end of the day, we can make this beautiful thing, but it would cost like $1 million. Who's going to buy it, right? So, you know, you have to take all these things in consideration.
Yeah, and I like how you phrased it too of, you know, what the big vision is. And like you said, your goal is to be in every single shoe in some capacity or another there.
Yeah.
Yeah, so I guess how do you think, you know, when you look at like what's next or what steps to take from here, like what are the most important things you're looking at? Is it, you know, how many of these soles you can sell, or is it some other metric that, you know, you're looking at to continually track the the progress?
Yeah, I would say the biggest thing that we are going after with our insole right now is value. We really want to solve a problem for people, and so we're really testing right now as we speak. We're giving out. We already have pre-orders, talking to our customers, understanding which part of their journey are we actually giving them the most value, and focusing and zooming on that. And as we get to that point, 100% being confident, that's when we're going to be already at a stage where we would like to sell, and our KPI would be, the number of insoles we sell. But at this point, our KPI is really to get that need for customers solving that pain that they have. So at this point, that's where we are.
Sounds good. Yeah, that makes sense. Yeah, just want to open it up if Steve or Brooke have any other questions. Otherwise, happy to continue here as well.
No, I'm good right now. I like her product.
Thank you. Thank you, Brooke.
Thank you. Thank you, Brooke. You're welcome. Interesting.
Great. Yeah, and so, what is it, or how do you think about, your product, like, I guess, selling directly versus partnering with other organizations, and, who makes a good partner to work with? Like, what are some of the characteristics you look for when you explore that approach?
Sure. Well, ideally, being a product company, we ideally envision us to be B2C product. So we want to have the customers who want to work with customers, who want to help them to solve their problem with their product. However, partnering with channels, distribution channels, I would say, is a very important aspect. Because we can get to our customers, let's say through, shoe companies. We can get to our customers through wellness companies, right? Health companies. So these are some of the kind of ways we look at getting to our customers. So currently we are selling on our website. At the same time, we are right now talking to various potential distribution channels, let it be, like I said, either shoe company or wellness company, exploring what are some of the opportunities we can, create, working together and understanding their customers, so and their customers' needs. So that's kind of where we are right now, but absolutely partnering with potential distribution channels like shoe companies or wellness companies is a way we're looking forward into, like, scaling and selling more.
What, I know you mentioned, like you had some trial users and gave out, insoles even before, you started putting this out to market there. So, like, what were some of the feedback you got that, got you really excited about what you were able to give people and how it could help them?
Sure. Well, as we sell, we got pre-orders on our website, so it was kind of a mini kind of campaign that we did, trying to see actually who's going to buy it without really spending much money on marketing. And so we got very interesting crowd out there, female, male, I would say, 50-50, ages mainly, up to, 30, 40. We have some that are over 40, a few. And some were excited to actually get their weight in their phone automatically on a daily, weekly basis. Some were excited to track their physical activity together with weight to help them stay healthy. So for most people, it was really, we're still out there. So like, I don't want to make things up, but from those that we've talked, these were some of the insights we've got so far. And also some of the feedback that we get as a, when they were buying it and just writing their comments. Basically, these were some of the comments that we got and some of the feedbacks that we received from talking to them as we continue to do that. We just started doing that, so we're on the way to finish completely talking to our all our pre-order customers. So that's where we are on a journey at this moment with Embry Tech. So, but definitely some of the highlights are either, love your product, really want to keep it to stay healthy and track my progress. And some were really interested in actually having that accountability of their weight done automatically on a daily, weekly basis, which motivates them to either, take actions depending on, what their weight says. So these are some of the major, two kind of feedbacks we've got so far.
Great. And is this, I think, is this a new movement in terms of technologies in the insoles? I know there's been a big movement in terms of watches and other trackers and devices over the last 5 or 10 years here, but haven't really seen anything else like your product. So are you guys sort of trying to take the lead in this space, or are there others that have a product that just isn't as successful as yours? Where do you see yourself in this fitness tech market on the insole side?
Well, to answer directly, we're not the first smart insoles, that's for sure. There are definitely already existing ones. However, most of the smart insoles that are existing right now in the market are serving particular very niche group, and mainly they are sportsmen. So either soccer players, basketball players, runners, right? So that actually helps to improve their play and their running capabilities, right? Or their let's say their soccer or basketball. So, so for example, they track and help you to run properly, or they try to tell you what was wrong with your run. Let's say for soccer or basketball, it tells you how hard you kicked your soccer ball or how high you jumped when you were dunking, right? So these are some of the current technology that is available. There's also a niche of a few insole companies that do GPS tracking, some that do add temperature. Let's say if you're skiing and your feet are cold, kind of smart insole that warms up your feet. So these are some of the current available technologies. With us, we're trying to hit the wellness category, right? And we want to be there at every aspect of their life, so we can be accountable and help them to reach their goal, because that's the main point. If you wear something for a short time, you can't be there all the time to help them achieve what they want. So we want to be we want to be the accountable body for them on their weight journey. And so our goal is to be there at all times while they're wearing their shoes, right? And we always say that, you can forget, when you leave your house, you can forget to wear your watch or your Fitbit or your, a band, but you will never forget to wear shoes. So,
right.
So basically, we're there, and for weight, and for weight, you want to be under your foot. So this is why we're in such a unique position, measuring the weight and being under your foot. So yeah, so I don't know if it answers your question.
Oh, it does. Yeah, I appreciate that. And it makes sense too, what you just said in terms of, you're always going to have this with you, and you're going to get, the information is going to come to you, and then, you know, be motivation, the way you develop it is you create it in a way that, you know, it's not just tracking. It's not just tracking everything. It's also like motivating you to keep, yeah, you know, to keep getting better and keep getting, you know, healthier and build up your wellness routine there.
Yeah. And I guess one more thing I would like to add is that there's a lot of wearables right now, and we understand that the trend is also create those type of wearables that are already exist in your life. You want to create new pieces. You just want to be inside of things that people already use. So this is also why shoes were, you know, such a hit for us. Also, you know, there's a lot of various wearables that, you know, track various things. For example, Apple Watch and Fitbit and other brands, right, that track things. And so we are there to kind of be the platform to provide, to take that all information data and try to analyze it and give users the recommendations and the kind of nudges they need to reach their goals. So that's kind of, we want to track their results and help them to get to their result that they put out there for themselves.
Great. And yeah, so how much, or I guess, like, yeah, when somebody comes in as a user for the first time, are they setting those goals that they want to hit, or are they like getting recommendations from the app on sort of, you know, what other users and their similar like weights and wellness profiles have put as their goals? Like how do you figure out, you know, what to recommend people?
So we, it's a good question. Yeah. So at this point, because we're new and we recommend them what, let's say, you know, CDC or, you know, some of the wellness organizations, global organizations recommend for a general wellness being. And as we get more data on them, we try to be individual. We try to give recommendations that are individualized per person, per user, so that we become more kind of intimate on that sense. But in the beginning, it's kind of a general thing. When they put in their goal, let's say, you know, they put in like, I weigh 160 and I want to be 140 pounds, let's say. And so the goal is 20-pound weight loss. So on that journey, we help them to actually tell them what is a healthy weight loss. You know, the 20 pounds, what is a time range that is healthy for them? And we try to kind of nudge and motivate them through our coach system to get there, but in a healthy way. Explaining what is weight fluctuations, what are normal, what are not, you know, and alert them when the weight goes down or goes up by analyzing their data and giving them certain recommendations.
And so do you think of this as like a virtual coach itself, or is it a tool that other coaches are going to be using to use with their clients?
So at this point, you know, it may change, as you already know. We've pivoted a few times. But at this point, we believe that we would like to be the coach for our users. And why not? Coaches can use us as a supplement, let's say, to their coaching systems, if it matches the philosophy behind us, right? But at this point, we want to give a direction for our users to get to their goals in a sustainable, healthy way.
Exciting.
Yeah.
Yeah. Hey, Joseph, did you have a question you wanted to jump in with?
Yes. Thank you. Thank you for allowing me to ask a question. I'm sorry I came in late. I had to send something to Jason out of all things. But so Jason, look at your email. But I do have a question. As Jason knows, that in my past, I used to work with a lot of pulmonologists, and because I was in the breathing world, and I was working for the device company, and we used to ask our patients for, the numbers. And so they have to, we had to send them one of those portable EKGs, and they had to send over to a landline phone, not to a cell phone, to a landline phone,
Sure.
to send us the information. So we need to take a look at it, and then we have to give the recommendations back to the pulmonologist. And so I'm quite sure, you being so smart and wise in your field, you can understand the technology has changed so drastically over the last 40 years or so. But can your product, or maybe some other products, can monitor people's breathing as well as some of the features that you've already mentioned already? That's my question.
So the question is, let me see if I grasped it correctly. So can our products right now monitor breathing, right? Track breathing, is that what you're saying? Currently, it cannot. It's a good question. Something we can, definitely put in our R&D list, because we are, as we speak, developing more and more features. However, because our weight is kind of the innovative piece of feature, and it puts us in a kind of weight management and industry. So weight, so breathing is kind of, maybe a secondary issue at this moment. However, I understand it's really important, and there's a lot of people with asthma today, with all these other issues that people may have, and shortness of breath. People are obese, maybe, right? They also have shortness of breath and problems breathing. So all of that is definitely component. But at this moment, we don't have any technology that is tracking that. But it's something we can look into. Yeah.
Great. Thank you for answering my question.
Yeah. Thank you, Joseph.
And so where does this fall into, and how do you think about the categories of if this is a tracking device and something that's just open to everybody to use versus making health recommendations and something that needs to go through or sort of be a certified approved health product? Yeah, how do you think about those aspects?
So yeah, a good point. So right now, as we speak, our product is entering the market as a technology. So we're selling technology, and there's a free app. As we get high in sales volume, our plan is to switch into monetizing on the app and actually delivering the technology at a low cost. So there would be a switch, but not right now, because we need to have data before we do that. And so the future is basically, for us, we want to monetize on our coach. So we want to put our effort and focus on our coach and the insight system that we take from the device.
Right.
Yes, I have actually another question. When you talk about wearables, do you have just one set of product or different product lines? Because as you know, there's wearables on the wrist, around the waist, and chest, and ankles and stuff, or maybe some fashionable wearables that you're thinking of, reaching out and branding. Because I saw commercials for diabetes. Did they have it at the back of the arm and stuff like that? It's not really wearables, but people notice it. But I'm just saying that, when I think of wearables, I think of, something that have to look good. And I think reason why I'm asking this question, because I have a friend of mine who's in lymphoma. And when you get these bandages and stuff like that from the hospitals, they are just, as you know, god ugly. And so what he did was he has the same kind of material, but he dressed up a little bit more fancier so the people with this condition doesn't stand out. And that was actually where my question was going to. I should have better phrased that. Sorry about that.
So I did show, so right now, all we have is insoles. So our technology right now is these smart insoles right here, that you get to charge wirelessly. And at this moment, that's all we have. I mean, we're a startup, so we're in a progress. We're thinking of maybe potentially adding more pieces, though we try to be and want to stay within your shoes. Basically, that's where we want to go. But there's some features, for example, like body composition, fat, water, and muscle. For that feature potential, we may be adding to get the results going, to get the data, but it's still under development. We try to stay within shoes. That's kind of our focus. But if we have to, maybe for V1 version 1, then we will maybe potentially add a small component. But whatever we do, our focus is on design and being user friendly. So we want to make sure that whatever we do is beautiful, is comfortable, and our users are happy to wear it. So at this time, it's only the insole and the app.
Actually, I'm sorry, I wasn't here at the beginning. Maybe I should have known that. Actually, I do have another question for you. Since you do have a shoe app, I have worked with Quadriplegics in the past. And as you know, they go through spasms and stuff like that every so often. Would your product detect that and send information to their caretaker and saying that they're going through a spasm?
So anything that is basically happens with feet, we can detect. So I would say, with a high chance that we would have to just do a little bit of testing before we can do, and sending that information to a caretaker. Yes, that's not a problem at all. So we can. But I think anything you sent to caretaker has to go from some type of FDA approval, because, doctors kind of, so it may open up another window of, entering the market slower, but, it's out there. Yeah. So again, anything with your feet, we can track.
And do you envision, this being part of or being sold within shoes, and, being like sold with a pair of shoes that you buy at a regular department store?
Yeah, ideally, we just want to be inside any shoe. So it's not even, I mean, in the first stages, yes, as an insole, but then potentially, more of a piece of technology that is embedded inside the shoe, and you just, buy the shoe. And we say, like, every smartphone has a built-in camera, every shoe will have built-in Embry. So today, when you buy camera or when you buy a phone, you don't really think about the camera, right? It just comes automatically. So it's the technology that is built in within the phone. So that's how we look at Embry. So when the person buys shoes, let's say 10 years down the road, they don't think of not having Embry inside. It's just there. And the information is available for everyone. It's easy to wear. It's convenient. So that's kind of how we look at it.
Great. And do you think, do you think the market is, more ready for this technology than they would have been 5 or 10 years ago? Like, I think there had been some, companies trying to do this in the past, but just from quick perspective, it seems like, it's more of a stage where everybody wants this information and, is excited to track and take, actually use the data. So yeah, how are you seeing that, that side of things?
Yeah, absolutely. The trend is kind of smiling and towards Embry. So we're excited and we want to, be on that wave and be inside of the shoes for sure. Previously, there were some attempts by companies, but it didn't work because the battery was too large or too heavy. Technology changed, sensors changed. So all of this kind of prompts you to go into shoes, and it's a very unique, special area that you can get a lot of information that you can't get from other places on your body.
And yeah, so what's and yeah, what are you looking for now, or what's helpful to get for everybody watching this on our community channel and our YouTube afterwards? Like, yeah, where are you looking for support to help Embry get to the next level here?
Sure, sure. Well, currently we are selling, so anyone who thinks, or after listening to our conversation here, if you think this product is something you're interested in, you think will give you value and will help you in solving your issues, feel free to go on our website and purchase and pre-order. We'll be starting shipping in September. And because the more users we have right now that feel that this is a great product for them, the better at this point to really work with them and get the product to the next level. That's one. Also, if you were a shoe company, a wellness company that you think your customers, users, people would love this product, definitely reach out. We would love to chat and see how we can collaborate, work. And I would say these are some of the top values that we can get right now.
Exciting. Yeah, looking forward to trying out maybe even, or yeah, I think no, if it's a September time frame, that's a pretty quick turnaround too in terms of pre-sales. And yeah, I think we'd all love to try this out here. So yeah, that's definitely exciting, and open it up to any other questions you guys have that are remaining here. But yeah, I think really enjoyed learning more about Embry Tech here and everything you guys are building. It's really, really valuable, and can't wait to see it sort of take shape here as you guys launch the full product.
Sure,
Absolutely.
thank you so much.
I think this is a fantastic product. I just came from, I have meetings as well with the ADA, and some of the speakers that in these forums are blind. They really are. And they're either fully blind or partially blind. And I can just imagine how your product can be in their shoes at the same time working with a shoemaker that has proximity, such as cars. And so the shoe can inform them of maybe a possible issue going ahead. Because I really like that, because one of the things these people explain is like, oh yeah, I got hit by 3 cars this past year. I was thinking, you're getting hit by cars? And so, I was like, how that happened. And so your product can go, I really like it. I think, if you can help.
It has use cases, a lot of use cases.
Yeah, if you can help those people, because as you know, being with a medical background, such as yourself, every time that you're in the hospital, it really takes a toll on somebody. It's just, especially if they have disabilities, that's really tough on them. And so I see your product can really help out in that market. And man, I love your product, and I really hope the best for you. Thank you.
Thanks, Joseph. Thank you, Joseph. Thank you for the encouragement.
Yeah, I don't want to follow that. I think, no, I think that's great.
Same here.
Yeah, super exciting. Yeah, we can share the link too to anybody that wants to check out the product with the video afterwards. And yeah, great to have these brainstorms from Joseph and everyone too on like other use cases and everyone that could benefit from your product here.
Awesome. Thank you so much, guys. Thank you for this opportunity, and happy to meet everyone. And let's kick it off and let's see where what happens next.
Excited to be part of the next chapter here.